Thank you, Professor Donato Romagnolo, for your kind presentation, and also to organize such a wonderful meeting together with all the Nutritional Science Department and the College of Agriculture and Health Science. It's very nice to have a Department of Nutritional Science in a College of Agriculture. I think it's the future, and Arizona is in the proper way because we should integrate nutrition with agriculture. Well, I'm going to talk about I'm going to give some, let's say, news around benefits of the Mediterranean diet. And I am talking of the benefits, a sentence that is going to define my presentations. It's from the hearth to the hearth, to the earth, okay? So the Mediterranean diet should be understood not only as a set of foods, but also as a cultural model, which involves the way the foods are selected, produced, processed, and distributed. That's very important. And as you know, the Mediterranean diet has been acknowledged recently by UNESCO as an intangible cultural heritage of human being, of humanity. And you can find the Mediterranean diet, yes? Okay. And you can find the Mediterranean diet in the UNESCO website. And this is the pyramid that defines the current knowledge of the Mediterranean diet. So where you can see the distributions of the different food groups according to the consumption. We have whole grain cereals, bread, fruits and vegetables. And we have also olives, we have nuts, we have herbs, spices, garlic, and onions, very important. We have dairies, products, less than 2 per day, preferably low fat. And we have also fish, we have white meats, some potatoes on a weekly basis, red meat also on a weekly basis, and sweets. But this is not the only, let's say, new of this pyramid. This pyramid tries to integrate other aspects of the Mediterranean diet, like the biodiversity, the seasonality of the foods, the traditional, local, eco-friendly products, and also the culinary activities. So this is not just food, it's the way that we prepare and to eat the food with the family all together. I am going to divide the updating benefits in 5 different areas. The first one is health, nutrition, and public health, the hearth. That's probably the most important because, you know, the public health is one of the main issues. But we have also other benefits on culture, heritage, and society. We have also benefits on biodiversity, landscape, and also rural in economy, rural development, agriculture and fishery support, and also finally on ecology, environment, and climate change pressure, the earth. If you look at the different policies for enhancing the sustainability of the Mediterranean diet, they cover all these aspects, from the health to the environment, the society, and the economy. Which are, from the point of view of health, the benefits of the Mediterranean diet? Well, this is a list of the most, let's say, important benefits ever described. Longevity and mortality, coronary heart disease, obesity, diabetes and metabolic syndrome, cancer, cognitive function, depression and other mental disorders, nutrition adequacy, quality of life, respiratory diseases. And we have been particularly working on coronary heart disease, obesity, Also diabetes and metabolic syndrome, depression and mental disorders, nutrition adequacy and quality of life. We have less experience on cancer and in other areas, and also respiratory diseases. So the nutritional epidemiology has suffered evolution of designs and also evolution of the exposure. So initially the designs in epidemiology were, let's say, concentrated on ecological designs, cross-sectional and international comparisons, like the 7 countries studies. Then we moved to case control, cohorts and nested case controls, and now we are randomized trials, which are not easy in nutrition epidemiology, because it's very difficult to randomize diet. And also the evolution of exposures has moved from a single macronutrient, carbohydrates, a type of fat, to micronutrients, antioxidants, vitamins, food items, food grouping, and indexes to food patterns. And now we are analyzing the food patterns, the diet as a whole, not just as a single food. And this is a very important thing. So we should concentrate on food patterns and as far as possible in randomized trials. Several years ago, we made a systematic review of the scientific evidence of intervention using the Mediterranean diet, and the evidence was very low. Not only on experimental designs, but also in big observational studies. Recently, we have been involved. There are many big observational studies that have facilitated extensive reviews of the evidence of the benefits of the Mediterranean diet in different chronic diseases, using big cohorts of the different parts of the world. So I recommend you to go into this paper, which is very clear and has been updating several times. Or that one that we brought together with Professor Antonio Tricopoulos and other colleagues from different parts of the Mediterranean diet. In terms of Mediterranean diet index, the most used index, so it's a way to compare the different studies across the world, is the one made by Antonio Tricopoulos and co-workers, which has 10 components: alcohol, legumes and beans, cereals, fresh fruits, vegetables, salads, olive oil, dairy, less meat, fish, and nuts. This is useful in terms of epidemiological studies to compare the different cohorts. But again, we should start to talk about not just foods, but the way the foods are produced and the way the foods are consumed. One of the most important benefits is going to talk later on by Professor Antonio Tricopoulos, who is here. I would like to just to make a few words of support of Antonia, because as you know, her husband, Dimitris Tricopoulos, passed away just a few weeks ago. Dimitris is one of the biggest epidemiologists in the history. So, couple of 100 years later, people are going to remember Dimitris Tricopoulos as we remember other important medical doctors and philosophers from the history of Greece. I'm going to talk on coronary heart diseases, and just a quick, let's say I'm going to make a concentration on one study which has been involved, which is the Preventive study. As you know, the projections of global mortality and burden of diseases shows an increase of cancer, as Professor Romagnolo has said just before, but also other diseases like respiratory diseases and particularly cardiovascular diseases. And you know that the lifetime risk of cardiovascular disease depends on the risk factors that we have. When the number of risk factors is of 2 or more of major risk factors, the risk of the risk of cardiovascular disease in females is more than 30% after the age of 80 and around 40% in males. The evidence, the observational studies assessing the association between 2 points increase in the adherence to Mediterranean diet score according to the Trichopoulos score, and the risk of mortality from incidence of cardiovascular disease is more or less around this percentage, which is some 10 to 15% of decrease. So every 2 points of increasing your score, you will decrease your risk of cardiovascular disease by 10 to 15%. And probably the highest evidence before the Preventive study on the effects of Mediterranean diet on cardiovascular disease was on the Hearth study by the group of Professor Longeril and Serge Renaud, who compared the Mediterranean diet with the low-fat diet in people suffering from a cardiovascular disease. So it was not primary prevention, it was secondary prevention. But at that time, the Mediterranean diet was already shown to be very effective to prevent a second cardiovascular disease event. The Preventive study is a large parallel group, multi-center, randomized, controlled, 6 years clinical trial aimed at assessing the effect of the Mediterranean diet on the primary prevention of cardiovascular disease. We defined 3 groups. One group with Mediterranean diet with a provision of extra virgin olive oil. A second group with Mediterranean diet with a provision of nuts. And a third group of a low-fat diet following the guidelines of the American Health Association. The number of people were 7,500 people randomized in these 3 groups, and they were followed by during 5 years on average. And this is the research group, different parts of Spain, from Barcelona to the Canary Islands to Madrid and Sevilla, Malaga, Pamplona, different parts of Spain, working together for this big study. And this is the publication published 14 months ago in the New England Journal of Medicine. It was a very important publication for the Mediterranean diet because it has a huge amount of news around the world about these findings. I'm just going to tell you summarily the brief results of this study. People were women ages 55 to 80 or men ages 60 to 80, randomized in these 3 groups. And you can see that there are at least half of the group were diabetic, 80% with hypertension, 15% smokers, 70% with high cholesterolemia, 30% were obese, with almost 100% with abdominal obesity. The primary endpoints was a group of cardiovascular death, myocardial infarction, and a stroke altogether. And we have a data safety and monitoring board that was meeting every year, which was composed by Professor Pissunyer from Columbia University, Franz Hook from Harvard, Joan Sabater from Loma Linda University, and Carlos Alberto González from the EPIC study, Spain. And after 5 years, they, let's say, recommend to stop the trial that was supposed to stay 1 year more, because the results were very, 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 very clear. We defined a score to define the adherence to the Mediterranean diet, which was composed with 14 food groups. We include several food like red meats, butter, and soda drinks. And also we include a preparation which is very popular, which is the sofrito, which is frying with olive oil, garlic, and onion, at least twice a week. So if a family don't use this kind of sofrito, I mean, very typical from the Mediterranean diet, they don't have, let's say, a complete adherence to it. So if we compare the three groups, we have the green with Mediterranean diet with virgin olive oil, red with nuts, and the control group in green. You have the change, an decrease of carbohydrates in both groups, increase in that group, fiber, particularly in the nuts groups, fat in both groups, saturated fat was decreased in both groups, with MUFA, particularly in this group, PUFA in the group of nuts, and also the olive oil obviously was higher in the group of Mediterranean diet. These are also the change in other foods. Nuts obviously was increasing in this group, like virgin olive oil. Refined cereals were decreasing in both groups, and for the rest of the groups, there were little changes. This was for fruits, increase in all the groups, legumes, particularly in the two groups of Mediterranean diet, meats decreased, the three groups, as well as dairy and alcohol. And this, we can see the same what I said before, this decrease of carbohydrates and this is the decrease in fat, total fat in that group. Just to be sure about the adherence to the change of the diet, we analyzed the plasma alpha-linolenic acid in the group of the different groups, and we can see, you can see the highest group in the group of nuts, and on the other hand, the urinary hydrotyrosol concentration was obviously highest in the group with extra virgin olive oil. And the primary endpoint shows a clear 30% reduction of cardiovascular disease, both in the group of olive oil and in the group of nuts after 5 years. This is the trend. You can see the low fat, the control diet, which is not totally low fat, but what's reduced a little bit, the fat was a higher, 30% higher incidence and mortality on cardiovascular diseases. Total mortality was not statistically significant, but we observed an important decrease in the extra virgin olive oil group. So, which one? This is the analysis of the duration between diet and cardiovascular disease risk, but which are the biological mechanisms that could explain these important changes, just modifying the olive oil, the nuts, and just providing some advice on Mediterranean diet. You can obtain these explanations in a previous paper in the Annals of Internal Medicine that was published from the Preventive group, where you can observe important changes just after 3 months of the follow-up, important changes in the diastolic blood pressure, in the total cholesterol level, LDL cholesterol level, HDL cholesterol, and triglycerides. And also in biomarkers like inflammation, the changes in CRP level, interleukin-6 were lower in both groups with Mediterranean diet. The change in ICAM also were lower in both groups, both ICAM 1, 2. So this was a very important, also important change in the insulin levels and in the OMA, in the insulin and resistant levels. As I told you, this study was an important impact in the media. It was published in the cover of the New York Times and the Boston Globe, many journals around the world. Not only, let's say, in the east, but also in the west, but also in the east. With, I think that they have something like 700,000 downloads of the paper in the New England Journal of Medicine, with around 400 citations in only 1 year. Other benefits of the Mediterranean diet are obesity, despite the fact that particularly our children are suffering an epidemic of obesity, particularly in the childhood. We have reviewed the obesity and the Mediterranean diet. We have made a systematic review of observational intervention studies, and we have not found any reason to support that the increasing adherence to a Mediterranean diet increase the prevalence of obesity, but just the contrary. So most of the studies support the idea that increasing the adherence to Mediterranean diet decrease the incidence of obesity. This is one analysis with a Preventive study, which is showing the risk of abdominal obesity according to the MedDiet score. This is a very low score, and this is the risk of having abdominal obesity. This is the highest score, which is a reduced risk, very important. Another study published some 10 years ago showed the effect of weight loss using a low carbohydrate rate compared with the Mediterranean diet. This is a study from Dr. Sheif from Israel, and the studies were very clear. They show that, in fact, the capacity of the Mediterranean diet to decrease weight in obese people was lower than other diets, like the low-carb diets, but the relapse of the diet was lower when using Mediterranean diet. So the relapse was particularly important in low-carbohydrate diet and in low-fat diet. Also in the Preventive study, we have shown the impact of the different groups, olive oil group, dairy, and low-fat. And we have shown that this is the group of low-fat, which is a highest body fat composition at the end of the follow-up. Just a few comments on white bread, because there is some concerns about the capacity or the weight of bread which is playing a role in the obesity right now. We have analyzed the bread consumption, and it continues to fall in most Mediterranean countries, and the obesity epidemic continues to grow. There were absence of specific studies regarding bread BMI or abdominal fat. And was no little information about what foods are replacing bread in our diet. So we make a systematic review about the relationship between bread consumption, body weight, and abdominal fat distribution. And from this systematic review that we conducted from the 78 to the 2008, we included all the studies. In the majority of the studies, following a pattern that includes bread was not associated with an increase in ponderal status. And consumption of whole grain bread is more beneficial than refined bread, especially in relation to abdominal fat. Whole grain bread do not influence weight gain, and white bread was possibly related to an excess of the abdominal fat at that time. For that reason, we conduct this study in the Preventive study, analyzing the changes in bread consumption and 4-year changes in adiposity in Spanish subjects at high cardiovascular disease. It was a cohort analysis of the Preventive study, and we finally include 2,213 patients, which has at least 2 years of follow-up and all the information regarding the bread and BMI. The main age was from 55 to 80 years, the woman, obviously men between 60 and 80 years. And the follow-up in that study was 4 years. So the consumption of bread, waist circumference, and BMI was analyzed at baseline. But also we analyzed the changes in weight and the changes in bread consumption. So we analyzed the changes in food groups consumption according to change in total bread consumption, the basal in weight, waist circumference, and BMI according to the quartiles of initial bread consumption, and the changes in weight and waist circumference according to quartiles of change in bread consumption. This is the changes in food groups according to the total bread consumption, and you can see that this is the people that decrease the bread intake during the 4 years of follow-up, and the people that increase an average of, let's say, 100 grams and decrease 100 grams. And this is the foods that are replaced. So we can see the people that decrease bread increase vegetables, people that increase bread decrease vegetables. So there are some interesting interaction also on fruits and also on dairy, which could be related to the effects of replacing breads by other foods. Also, when analyzing the baseline weight and waist circumference and BMI, we show that at baseline, so in a cross-sectional analysis, usually there is no relation between bread consumption and BMI because there are some, let's say, bias. So people with the highest BMI tend to reduce the bread intake at baseline. But at follow-up, analyzing the change in weight and waist circumference according to the quartiles of change of bread consumption, here you have the changes in bread, and you can see the weight change, which is significantly most important in those people that increase their weight. So it is not clinical, probably not very clinical relevant, but there is a difference about 1 centimeter or 1.5 centimeters of difference between the two groups. So people that increase bread increase more the body fat and the body weight. So this is relevant for us because it's a concern about a food which is part of the Mediterranean diet. It's very important. You know, the white bread has a lot of connotations from the point of view of a religious point of view also. And the possible factors involved in this beneficial or detrimental action of bread could be energy density, glycemic index, dietary fiber, the microbiota. And so we need more studies using traditional ways of bread production that should analyze its effects on weight and metabolic regulation, because now the bread that we consume is probably a bread which is more produced in a more modern way with refined ingredients. We will have other concerns in the future. What is going to happen with fried foods, potatoes? What is going to fruit as a dessert? What is going to happen about whole-fat dairy products? Honey in festivity desserts? Should obesity drive our Mediterranean diet policy, or should also take into account other aspects of health or other aspects like culture or environment? This is a study published by the group in Madrid that shows clearly that the fried foods, which is very used in Spain, is not associated with a higher risk of cardiovascular diseases. But on the other hand, we know that people that use fried foods tend to be more obese. Another aspect is depression. I'm going to be a little quickly because my time is going out very quickly. And also in the south, in the Mediterranean countries, we have lower rates of suicide and lower rates of mental disorders and depression. This is because of the climate, lifestyles, cultural factors, or maybe food and nutrition also play a role. So we know that regarding mental health, there are several aspects of the foods: B vitamins, some bioactive compounds, trans fatty acids, and omega-3 fatty acids that may play a major role preventing this depression. And we have particularly core groups like fish and nuts, legumes, vegetables and fruits, olive oil, virgin olive oil, and a low intake of meat products and certain fats that could be also very important in this area. We have analyzed first in a cohort, the SUN cohort, the cohort of the University of Navarra, which is directed by Miguel Ángel Martínez González. We have analyzed the association of the Mediterranean diet pattern with the incidence of depression. We have published in the Archives of General Psychiatry 6 years ago, and also the impact of trans fatty acids on depression. And the results were clear. So when we increased the adherence to the Mediterranean diet, the incidence of new cases of depression was lower. And this is in partly attributed to fruits and nuts and legumes, and in a detrimental way to meats and sausage. Also, we analyzed this in the Preventive study using the 3 groups and analyzing the incidence of depression, of new cases of depression in the 3 groups, the virgin olive oil, nuts, and low-fat groups. And we have observed a protective effect, particularly in the group of nuts, a lower incidence of depression in the group of Mediterranean diet and nuts. When we analyze in the groups with people with depression, we have analyzed the plasma of different neurotransmitters related to depression. We observe that at the protective, we observe that in the group of nuts, they observe highest level of these neurotransmitters. So it could be a way to explain this lower incidence of depression in the groups with Mediterranean diet and nuts. And in fact, most of the factors for depression could be also observed for cardiovascular diseases, which most of the risk factors are the same. So in general, what is good for your health is good for your brain. Particularly, you should eat more vegetables and do more physical activity. Just a quick comment on the culture. I was talking about bread, and bread is very important from the cultural point of view. We should not lose our bread, or white typical bread. And the Mediterranean diet translation, the nomination was was obtained by UNESCO. This convention is trying to safeguarding the intangible cultural heritage to ensure the respect and to raise the awareness of the intangible cultural heritage. And the cultural heritage, it means the practice, representations, expressions, knowledge, skills, as well as the instruments, objects, and artifacts that are associated with communities, groups, and in some cases individuals recognized as part of their cultural heritage. This is the intangible cultural heritage. It's transmitted from generations to generation and constantly recreated by communities and groups in response to their environment, their interaction with nature, and their history, and providing them with a sense of identity and continuing those promoting respect for cultural diversity and human creativity. So in a certain way, the Mediterranean diet was on this definition, because the Mediterranean diet is a millennium-old cultural corpus, which is an intangible cultural heritage. It works from the Greek word deity, which is way of life. It comes also from the Mediterranean, comes from the Latin, sea between lands. There are many civilizations that are Egyptians, Hebrews, Phoenicians, Punics, that this succession of civilizations has given a contribution to the richness of the Mediterranean diet. And this ensemble of practices, representations, expressions, knowledge, skills, spaces, and associated objectives that people around the Mediterranean have created and historically recreate in interaction with nature, and always around food. This intangible heritage is part of the inheritance that favors rural sustainability and reproduce a symbolization system. Eaten together is the foundation of social practices and many rituals and festivities. In the Mediterranean, we do not sit at table only to eat, but to eat together. That's what's said by Plutarch. So the heritage is these techniques, the procedures, these abilities ranging from the landscape to the table. And this is what we tend to protect. And I'm going to be a little bit, because my time is going up. So the reasons for the nomination were obviously to try to conserve all this legacy, because we know that there are some menace from the Mediterranean diet, particularly the effect of globalization and the social transformations have set of the alert on the dangers that Mediterranean diet can suffer. So this inscription will protect or contribute to give visibility of this network of institutions, associations, and foundations that are trying to reactivate the Mediterranean diet. And I am sure the University of Arizona is going to contribute in the future to that recognition. The inscription was made by 4 states, Italy, Greece, Morocco, and Spain, and was finally obtained in November 16, 2010 in Nairobi, in Kenya. So the Mediterranean diet is already in the representative list of the intangible cultural heritage of human being. And you can see in the webpage all the documentations that was submitted for that. Also, it receives a lot of media support. Biodiversity is also an important benefit, particularly on the mitigation of climate change and also of the adaptation of the strategies for agricultural food security. I recommend this book from WHO, Biodiversity and Nutrition, A Common Path. And also the economy, the rural development, agriculture, and fishery support. Many people said that the Mediterranean diet is too expensive. And it's true that if we look at the different diets around the world, this is the people with the poorest diet in Chad, in Africa. This is not a proper diet. This is a deficient in many foods. In Bhutan, it's also a very poor country. We observe a diet which is a little bit richer, but also with some deficiencies. Also in Ecuador. But for instance, in this picture from Egypt, for $68 per week, you can find a quite varied diet, which is close to the Mediterranean diet. And when we increase the family prices, we do not necessarily increase the quality of the diet itself. For instance, in Mexico, 200 per week, we have a lot of soft drinks, a lot of processed foods. And also in London, a lot of foods, also for pets' food. In Italy, it's a quite modern Mediterranean diet with a lot of bread and a lot of pasta. And North California, a lot of food over the phone, less cooking at home. And Germany. And in fact, we know that an increase in the individual monetary diet cost improves diet quality and weight management, at least in Spain. We have been following for 10 years a cohort, and we have observed that people that increase more the diet increase these fruits and vegetables more. So the people that decrease the budget decrease the fruits and vegetables. And this is very important because now we are having an important crisis in Europe. We have suffering from important economical restrictions, and this is affecting diet of the population. The Mediterranean diet has been deteriorating, and this has important repercussions of weight and BMI. So an increase in diet cost predicts changes for a healthy diet and better weight management. And so the impact of a decrease in individual diet cost is of concern for public health. And finally, the ecological environment and climate change pressure. I'm going to be very, very quickly because I am out of my time. I'm sorry. So you know that food production is an inevitable driver of environmental pressures, and particularly in relation to climate change, water use, and toxic emissions. So we know that the greenhouse emissions are responsible for global warming, some of them made by the agriculture, other for emissions to the use of fossil fuels. And the animal-based foods are by far the most land and energy intensive compared to foods and vegetable origins. So the Mediterranean diet seems to be a plant-centered dietary pattern that not exclude meat and seems to emerge as an hypothetical dietary pattern that could address both health and environmental concerns. And so we make a study trying to analyze the sustainability of the Mediterranean diet in the context of the Spanish diet, and we compared it with the Western dietary pattern, which was the North American dietary pattern, and is the first study ever published about the sustainability of the Mediterranean diet. We use several sources of information, both regarding dietary composition and the different footprints analyzed. We use the gas emissions and also the agricultural land use, the energy consumption, and the water consumption. The results of the study shows clear that the lowest footprints in all the environmental pressures taken into consideration was the Mediterranean diet, and the highest was the Western dietary pattern, the American pattern. The adherence to the Spanish pattern was between both the Mediterranean and the Western dietary pattern. And if you analyze the different indicators, agricultural land use, the Mediterranean dietary pattern, the Spanish is an average of these two, and the Western dietary pattern. Energy consumption, this is Mediterranean dietary pattern, the Western dietary pattern. Water consumption, the Mediterranean dietary pattern and the Western dietary pattern. And greenhouse emissions, this is the Mediterranean pattern, and this is the Western dietary pattern for a population of Spain. So the differences are very, very important. So the Mediterranean pattern in Spain should sustainably reduce the gas emissions, the agricultural land use, and the energy consumption and the water consumption. On the contrary, the adherence to a Western dietary pattern, to a fast food pattern, would imply an increase in all of the descriptors of between 12 and 72%. So animal products contributed significantly to the increase of dietary pattern footprints and also dairy products. I am not going into the details, but if you want to look at this paper, is published in this Environmental Health, is a free access journal, and you can get the main results of it. Other people have analyzed this area, which is a special concern in all over the world. There are this study from the group of Harvard and other parts, and also other people in Holland have analyzed this problem, comparing the sustainability and the health property, the health score of the different diets. And in fact, when you compare the health score and the sustainability, the vegan is here, but the average score is probably highest for the Mediterranean diet than for the vegan one. And the sustainability is always better for the vegan diet, obviously. So, in a certain way, the foods that we recommend are more environmental friendly, and the foods that we do not recommend or recommend to reduce in the Mediterranean diet have more environmental impact. So the Mediterranean diet is could be in a certain way could be shown as a food that protects. It's a cultural model, but it's a healthy and also environmental friendly model, whose adherence would have, in addition to the well-known benefits and public health, significantly have a significant contribution to a greater sustainability of the food production and consumption with less environmental impact. And just to finish, some lessons learned. So we can draft some conditions for a food to be considered part of the Mediterranean diet. Should be healthier, that's very important, with strong evidence, as a part of the food pattern. Should be culturally acceptable and respectful with the traditions. Locally grown are possible or produced in a, let's say, not too far area. Affordable and economical convenient, and sustainable and respectful with the environment. We are working in that pressure to assess the different indicators of sustainability of the Mediterranean diet with different groups. And the new foundation, the International Foundation of Mediterranean Diet, is going to work in these 5 areas of concern of Mediterranean diet, not only public health, but also environment and culture and other aspects. To finish this slide. What is this? This is a typical, very typical and traditional Catalan, I'm not going to say pizza because it's not a pizza, but it's a piece of bread. You can see that you have a sardine, and we have different vegetables, but not tomato, because it is a very ancient recipe. It's produced near Tarragona. You know, Imperial Tarraco was a very important Roman city. And this is produced in the same way that was produced 2,000 years ago. Exactly the same way. The sardine could be a little different, but it's exactly the way. So it's important to protect our tradition, and this is a part of the tradition, because if a certain, I'd say, fast food company is going to produce this, what is going to change? The type of bread, is going to add tomato and then put a lot of cheese. But it will be not the same. So sometimes the same foods are not the same because they are not respecting the ingredients at the different traditions. So thank you very much for your attention. I'm sorry for this delay.